All right. Hello, everyone. It is February 22nd, around 7 o'clock. This is Professor Widener. We're going to review for the epidemiology midterm. I will go through it and kind of offer you some tips that I have, and then you can certainly ask any other questions. I'm happy to answer them. The first thing is, as far as the test details, this will look very much like the quiz that you took in preparation. And that really was just to kind of practice doing questions, but also to practice the format. And it will be that same exact format. And for those of you who have either been in our program in the past or are in the BSN to DNP, this will not be done on Respondus lockdown. There will be the test window is from Saturday at 6 a.m. And I'm sorry you hear my dog barking in the background. So on Saturday, it will start on March 1st at 6 a.m. until March 4th at 23:59. The one thing I will tell you is if you run into any problems during that, I always give everybody my cell phone number. Make sure you text me if you have issues during that time, because we can always work it out. Computers are not 100%, technology is 100%, not 100%. But if there is an issue and you have a problem during that time frame, just feel free to text me. Please know if it's from 10 a.m. to like 6 a.m. I'm sorry, 10 p.m. till 6 a.m. I will probably be asleep and we'll deal with it in the morning that there is no emergency. So it'll be a 50 questions, multiple choice. The questions will be randomized, so every person will take a different test, but similar questions. There will be a 60-minute time limit. You will be able to use your book too, but in thinking about that, you do have 60 minutes. So it's still important to have a good handle on, what the concepts that we list here. So you don't have to look everything up because you will not have time to do that. Something I might do is if there's something that's a little harder to understand, or if you're having a hard time kind of understanding that concept, or you think it might be more difficult, is maybe tab your book ahead of time with that specific topic, like maybe the epidemiological triad is a little difficult to understand. Maybe put a tab there so you know where that is in your book if you need to reference it quickly. But the goal is, we want everyone to do well. And some of this is going to come instinctively and some of it will not. But I tried to narrow down in this outline what you need to know. Now, remember, again, some of this is going to be like the social determinants of health. You need to know like what they are and then how they influence things. Like how do they influence health disparities? How do they influence people's lives? So you will need to be able to apply the information as well. The test bank comes directly from the book. So I can pick, there's a bunch of questions for each chapter. So I know more what we focused on and what we haven't, so I can pick all those. But again, these are going to be the general concepts, kind of the application and definitions. It's going to cover weeks 1 through 6. And the other thing I put in here is that there's a lot of formulas. And I'm not a fan of memorizing formulas because if you need to know how to calculate like a relative risk ratio, you can go look that up. I do think it's important to understand how mortality and morbidity rates are calculated. And I do have that as the only formula you will need to know. The rest of them, you just need to understand the concept because I think that's what will be most useful. So does anybody have any specific questions about the test details before we go into the specific topics?
Nope, I'm good. I think we should keep rolling. The more
Okay.
we can get in, the better we are.
Yeah, no, and I think again, the make sure you pick a time. I know this is going to be the first test many of you have taken in a while. Make sure you have a quiet space as you can, and try to be non-distracted for that hour. Although I understand because I have little children, we all have children, dogs, families, but try and keep that hour set aside as best you can so you can concentrate. So for chapters 1 through 9, these are some of the topics that I felt were important and are easily applicable to practice. So it's going to be important to know the characteristics of population and population health. And we also want to be able to talk about the difference in the strategies between population health strategies and population management strategies. The other thing is, as nurses, we're and as DNPs, as we take our learning to the next level and we start to think about systems and we start to think about the population as a whole, we need to understand how epidemiology is important to population health. It informs a lot of what we do by looking at how illness starts, what are the risk factors. This is really where treating our illnesses starts, with knowing some of the background information with how we got there. Social determinants of health, kind of again, know what kind of is the definition and then what are the things that determine them. And I think if you think about it, you see these in your everyday practice. These are the things, social status, whether they have, food is a big one, housing, all those things, age, race can be a social determinant of health. All these different things affect our patients, and we see that because we're in practice. The other thing is you want to know what a risk factor is and how it affects health. And epidemiology is the way we learn about risk factors. We look at a bunch of patients that have something, and then we kind of look and see what developed. And actually, we'll go down a smidge into the nurses' health study, but that's the interesting thing about the nurses' health study. It's gone over a course of 30 years right now, and it continues to go. It's in its fourth stage. But what they do is they followed nurses with chronic diseases, and they've just followed them for years. And this is how we have learned a lot about risk factors and how things develop, because the nurses are answering questions every year, and then the epidemiologists are looking at that data to kind of say over a period of time, these are the risk factors that we've determined, and these are the ones that we know are a little bit different. And the Framingham Heart Study is the same way. I mean, that's really what led us to know that women have different signs and symptoms of heart attacks than men. This is where kind of that original data came from. So it's kind of interesting when you look at all that. So going back up here, when we talk about the social determinants of health, you want to think about how that affects health inequalities. We also want to think about health disparities and health care disparities. Right here in northeastern Pennsylvania, one of the things we have a huge problem with is lack of mental health services. And I would say that's a disparity in our area. The chapter 2 on the role, most of this be pretty easy for you to understand. But again, you want to just know why epidemiology is important to us as advanced practice nurses. You're in the role of an advanced practice nurse now, so you're going to kind of understand that we use this to inform how we treat our patients, how we educate our patients. Then at the heart of epidemiology, you just want to be able to kind of know what it is. And then there are two kinds of, you want to be able to compare and contrast descriptive and analytical epidemiology. And I actually marked the page because the table on page 31 gives an excellent example of, like, if I was going to study what are the compare and contrast of descriptive and analytical epidemiology, that's like the table that I would kind of highlight and know the differences between. And it kind of summarizes everything in a nice spot. The other thing is that right above it in box 4.2 and box 4.3, it also gives the definition or kind of the differences between the epidemiological approach and the scientific approach. So that page 31 kind of works out those two points. The epidemiological triangle, again, you want to know what it is And what are the basic things about that? And how do we use that to inform our environment? And if you look on page 33, there's a picture of the epidemiological triangle, and it also gives uh, some examples of the agent, such as its infectivity, its um, pathogenicity, and then the host, some things to consider like age, sex, genotype, behaviors, lifestyles, and then the environmental settings too. And one of the big things that I think the next part we talk about the history is it was epidemiology that started informing us about occupational health hazards. And that was a big thing that the epidemiology has contributed to. There's been so many things, but that's one of the things as well. But those 31 and 33 are good pages to kind of highlight, and I'd probably tag those for the test, just if you needed to refresh your memory quick on something. What I'm going to tell you about the history section is that these are the people you'll be responsible to kind of know about. And I'm not going to ask you to compare and contrast them, but just know their name and why they were important to the field of epidemiology. And if you look at the last sentence of each of the descriptions of each of them, that one kind of gives you the down and dirty of why they were important. You will only need to know the ones that are listed here, because I think these are the big ones, and I think that these are the ones that when you'll be able to hear their names and kind of know what they did. Not that all of them aren't important, but I think I'm very much a practical my teaching style is very practical, and I think these are the ones that are important to know. So we talked a little bit about knowing the importance of the Framingham Heart Study and the Nurses' Health Study. You want to know a little bit about the natural stages of disease. And then again, as the interest, I think it's interesting taking the course right now in the setting of COVID-19, because we've learned about so many different types of immunity and prevention strategies in population health. Um, and so make sure you know the different kinds of immunity and the different strategies that you can use to control outbreaks. And when we look at those, the chain of infection, how we prevent things from transmitting or how we stop the chain of infection is by different things that we do. One thing we can do is vaccinations. That's one thing to help break the chain of infection. The other thing, in the hospital we did was we knew that we could wear N95s and that would stop the transmission of the infection. So we did that to break the transmission. So hopefully that makes sense. But it's kind of like washing your hands after you go to the bathroom. It stops the chain of infection if there's any chance of it. You want to know the different levels of prevention. And there is a page, let me tell you what it is, where it describes the effective surveillance system factors. And again, this is important to know because as we've just gone through the pandemic, how did we surveil? How did we do our surveillance? And this gives you some more information into that. And let me find that for you quick. Oh, if you go to page, I know this is in the PowerPoint, but if you go to page 73, the World Health Organization and the CDC give general things that influence surveillance systems. That's another thing I would probably tag for the test. Then the next thing we're going to talk about is outbreak, which I think is kind of interesting. How do we find out about these outbreaks and how do we follow them? And the outbreak investigation is, again, it's in the PowerPoints, but it's on page 76 and 77. Again, I need you to understand this to be able to apply it to situations. So when we talk about mortality and morbidity, obviously it's important to know what they are. There may be a question, there's one question about the formula, but again, these are the only two formulas you will need to know. So I would either mark them off or put them, on a sheet, on a sticky on the front of your book or something like that. But that is the only, those will be the only two that you need to know. And just be sure that you know obviously what they are as well. Another thing that's important to know is, where do we get our morbidity data? It's important to understand that we can get it from disease registries. Because all of you are already in practice, you know there's certain diseases that we have to report to the state of Pennsylvania or to the CDC. So that's one method. There's educational data. Uh, they actually use absentee records from students to predict morbidity status. They use insurance data, um, healthcare facility data, and there's a little box that gives a perfect summary of it on page 83. Again, if we're going to understand these things and be able to apply them and talk to our patients about diseases, it's important to know how we get these numbers and for us to understand where they come from so we can explain it to our patients in, basics language that they can understand. Then when we talk about risks, we're going to talk about screening versus diagnostic testing. And this is the start of chapter 8. Again, just something important to know, how to talk to people about them and why we do them. Sensitivity versus specificity. Again, know the definition and kind of how to apply them. When we talk about reliability, we need to understand what reliability is so we can talk to our patients about it. And we need to know, if we're going to make a recommendation for a test, we need to know that what we're recommending is reliable. So again, know the definition and kind of how you would apply that. And we're looking at risk assessment. You want to kind of know how to do that. And there's a nice summary table on page 109. And I think it's interesting. I think as healthcare providers, it's very important that we understand how to talk to someone about risk assessment. I mean, you guys probably saw it firsthand, but when COVID first hit, kind of by the summer, when in the beginning, it was like all hands on deck, everybody's doing what they can. But once we kind of figured out who it was affecting more, like older people or people who had more comorbidities, the crazy thing is, in the communities, the older people didn't think they were at risk at all. And then we had younger people who were like, 19, 20, early 30s, who were staying home hibernating, thinking they were at a large risk when they were not. So I think one of our duties as healthcare providers is to be able to talk to people about the risk. And I think part of that starts with us understanding how we make a risk assessment and how that translates into practice for our patients. And again, relative risk, just know it's important to know the definition and be able to apply it. I did not write down everything from chapters 10 through 16 because I did exit chapter 15 because I don't think we need to memorize all these formulas in this particular class. We will use formulas down the road, but I did not think we needed to know them right here. So there's a lot of information there. We're looking for very general terms about those kinds of epidemiological studies. They're going to be very general. So know the PowerPoints have the information on them that you'll need to kind of be aware of for the test. So I was very intentional about making those PowerPoints as not to be too overwhelming with a whole bunch of information. I need you to know, for example, what a cohort study is and when you use it, but we don't need to be proficient at being able to perform cohort studies. I hope that makes sense to everyone. So does anybody have any questions about that, or you look at anything or have questions? I'm here for you, and I'm happy to answer anything you have. So again, just thinking about, Jen had mentioned it's been a little time since she's taken a multiple choice test. So again, tests are online now, and that's the way we give them, but that doesn't mean you can't have a piece of scratch paper to, to think through your choices. So if you know the answer, go with the answer you know, because the one thing we know for sure is that when you decide to change your answer and you're very sure of that answer that comes up first, you always change it to the wrong one. So if you're sure of an answer, just kind of check that question off and move forward. Don't really go back to it and overthink it. Where test taking skills come into play is when you don't know the answer to a question. So let's say you look at a question about, let's just say a social determinant of health, and your job is to pick the social determinant of health. Well, let's say you can eliminate two, eliminate everything that you can. Because if you can get rid of two, you're already down to a 50-50 chance, and those odds are better than 25%. And then look at the answer and see if you can figure out what which one it might be. Make the best educated guess that you can. The other thing that is important is to remember what part of the question is important. So if we say something like, if we're talking about social determinant of health, we say Sally works at, the doctor's office. She um she does all these she does all these she does all these things, she's got a income, she has stable housing, and then it gives this long answer about Sally, and then it says comma, what is the social determinant of health? The question is not asking anything about Sally. That's there to give you context, but the question is not asking anything about Sally. All it wants to know is, of those four choices, which one is the social determinant of health? So if you're having trouble with a question, try and tease out the important words and what's not important, and that will help a lot. The other test taking tip I have is that I think as nurses, we tend to overthink things. And I was not a very good test taker going through like my MSN and my BSN. But one day somebody said to me, Melissa, if it's not there, it's normal. Because we tend to overthink things, right? If as nurses, we overthink because we think, if you have somebody, you know, we know the first blood pressure medicine according to the guidelines is hydrochlorothiazide. And if that's what the question is, that's the answer you put. In my head, I'd be thinking, well, what if they have diabetes? What if they have this? They have that? Don't let your mind wander. If you start thinking about it and it's not there, it's normal. Because again, that goes to staying back to focused on exactly what they're asking. So those are my best test taking tips. I hope that they help. I think what I will do now is stop the recording and then let me stop the share. And then if anybody has any questions, I'm happy to answer them.